So we're going to do caregiver training, and in this video series, we're doing bed mobility. Um, Getting an elderly person or deconditioned person out of the bed can be physically demanding for both the patient and the caregiver. One reason is that both the patient and caregiver use poor techniques. This short video will show you the proper techniques. In many cases, moving the leg off the bed and trying to do a sit-up from a person flat on the back is the common way that people try to get out of bed. Once in this position, they frequently need someone to help pull them up. This is generally done by pulling on both arms while the patient essentially tries to do a sit-up. It's hard on both the patient and the caregiver. Plus, it can really cause an injury to either or both if done repeatedly. In this tutorial, we'll show you a better way. We'll use the log roll technique. It's safe, it's slow and methodical, easy on the caregiver and the care recipient. There is no tugging or pulling on the patient. It doesn't take a lot of effort. It emphasizes leverage and momentum rather than strength. Even people who are weak can perform this. Plus, it empowers the patient and encourages them to participate in their mobility. So you start with the patient in the hook lying position if possible. They're laying flat on their back, knees are bent, feet are flat on the bed. This is also a good position to roll them from side to side if you're performing hygiene or pressure relief. From the hook lying position, you initiate the log roll. This is started by the patient. They reach across their body toward the edge of the bed, flopping their knees and rolling the rest of their body in one motion. I usually like to say this is where you have the nose, navel, and knees all moving in the same direction at the same time. The log roll is initiated by peeling the shoulder off the bed, the opposite shoulder off the bed, while allowing the legs to flop to the side. If there is a bed rail or a nightstand, the patient can use this to help get them into side lying. Keep in mind, this picture shows you a position that you want to avoid. Some people misunderstand the log roll and end up twisting the body. Notice in this photo, the shoulders remain flat on the bed while the lower body is twisted to one side. If you try to use this technique this way, it's going to cause a lot of discomfort and be difficult getting the person up from the bed. After log rolling, the patient should be in side lying. This is a rest stop area where the person is still supported, but they are safe and they're able to rest in this position if they need to, or the caregiver is able to take a break and set up the environment by getting a wheelchair or bedside commode or what have you. When you're going from side lying to sitting, you want to bring the feet forward off the bed first. This is going to create a lever action in the body. As the legs drop down to the floor, the care recipient uses their arm and elbow to push their body off the bed into a sitting position. Now, once in the sitting position, again, the patient or the care recipient is safe and secure. You want to make sure that they're sitting up straight or slightly leaning forward rather than leaning back, as they will end up falling back on the bed. So the summary of the log roll technique is it's safe, it's slow and methodical. It's easy on the caregiver. There is no tugging and pulling on the care recipient. It doesn't take a lot of effort. There's always areas where you can rest and gather yourself and prepare the environment. So that is caregiver training bed mobility.